one last technique, and this is to work the round ligaments. So as we've kind of discussed on previous pregnancy videos on our channel, most people don't realize that your uterus is actually attached, or at least attached to other soft tissue structures, to your pelvis in 6 different spots. We have what we call the uterine sacral ligament, which goes to the back and attaches to the tailbone. That's why we do like the piriformis release, the sacrotuberous ligament release. We do the drop adjustment at the sacrum. We have 2 that kind of go out to the side and attach to the side of the wings there. That's why we gave you for home things to do like the sacral counter pressure or the hip squeeze technique to try to work on that. The last thing is called the round ligaments. These guys leave the front of the uterus. They don't exactly attach right onto the pelvic bone, but they attach into part of that mesh that's really close to like the hip flexor and right through the front there. So it's going to be really nice if we could do a little pressure and release those on both sides.
Yeah.
So how do we find it, right? You know the trick, right? So you're going to point to your belly button for me, because I don't even want to take any guesses as to where it is at this point. So she points to her belly button. There's 2 prominences on the front of the pelvis. That's called the ASIS. So it's right here. And pretty much we do 2 45-degree angle windows. So I go down from about 45 from her thumb, and I go down 45 from my thumbs, and it should be really darn close to right about here. So you can relax, and then I'm just doing some thumb pressures. I'm pretty much right on your round ligament there, right?
Yeah.
How's that feel?
Good.
And we don't have to push too hard. This is another one of those techniques where a little bit of pressure makes a big difference. It just kind of like there's probably a little bit of a tighter spot right there. Do you feel that?
Yeah.
And it's over on your right side, correct?
Yeah.
It's another one of those where typically we're going to find it on the opposite side where that sacrum decided to rock itself out, but it doesn't always have to work that way and everything. At least we're not making your customer too mad in there this time, right?
I know.
Okay. Does that feel okay?
Yeah.
All right. And that's it. So the